Hello, my name is Dr. Michael Veselak, and today we're going to talk about functional medicine and why it is important to utilize functional medicine in treating these chronic degenerative conditions such as neuropathy, fibromyalgia, and even dementia Alzheimer's. To give you a little bit of background, I've been a chiropractor for about 34, 35 years now, and my practice has trended towards more of the functional medicine, functional neurology route. I'm board certified in integrative medicine, and I am a functional medicine practitioner. Approximately a year ago, I wrote this book. It's called Understanding, Managing, and Improving Your Peripheral Neuropathy. And fortunately, it has been one of the top sellers on Amazon ever since it's been published for the past year. I'm currently doing a second edition on it and trying to update anything that I've learned since the time that I wrote it. Anyway, today we're going to talk about why functional medicine. And to start with, I really want to go over like three major objectives. First, I want to teach you the fundamentals of functional medicine. Second, I want to talk about common conditions that can benefit from functional medicine. And third, I want to share with you how I address my chronic health patient. So we probably know that chronic disease in the U.S. is just skyrocketing. We hear about all these cases of autoimmunity, the neuropathy, Alzheimer's, anxiety, depression, diabetes, and a lot of these cases are not even diagnosed. And people, oftentimes won't go see the doctor, and they continue to progress, and there aren't really any cures for them. So conventional medicine is fantastic for things like acute care, but it falls way short in chronic care. If you've been to a doctor recently, it's just sometimes hard to get the test that we want. It's actually hard to find the time to even talk about your problems. And the main focus is really on symptoms, not causes. And the treatment is driven mainly by pharmaceuticals. And it's more of a model now that's more, it reacts to the patient. It's not really a proactive model, it's a reactive model. So on the other hand, functional medicine, really what they address, it's more of a individualized approach. They focus on addressing the underlying cause, not just treating the symptoms. They look at the whole body, which is a must when you treat any of these chronic conditions. And mainly the recommendations are through diet and lifestyle changes. So in my opinion, this is the medicine of the 21st century. So it looks at not only symptoms, but it looks at things like genetics, your environmental factors, like did you have any exposure, where you live, are you, do you have mold in your house, are you subject to heavy metal toxicity? And then lifestyle. I mean, it's important to look at how you sleep and do you exercise and what are you actually eating. And then, of course, like I just said, proper nutrition. You have to eat right. So we all should be taught, like in the first grade or even kindergarten, every grade thereafter is the right way to eat, the right way to exercise, all about, decreasing stress in our body, things that are actually really important to us, that actually invest in our future. So the best diet really is we should eat just whole foods, not processed foods. And we probably know that, but it's so hard to do because you go through the market and there is no good food except on the perimeters of the market. So it's very hard to just stay a whole food based diet. But that really is the best diet, especially if you do have a chronic health condition. So some of the reasons why we prefer functional medicine is, as I said, it's a whole body approach. Its goal is to support the body's natural ability to heal itself, which it will do. That's what it's supposed to. It's supposed to maintain homeostasis, and then to treat the person, not the disease. We always say in our office that when people come in with these diagnoses, that most of the time I don't even know what the heck they mean, or I shouldn't say what they mean, but they're just these diagnoses that are so long and complex, just so we can give this ICD-10 code to build the insurance. So I always say labels are for cans and not for people. So I really don't even pay attention to diagnosis. I care about my findings. I care about my exam. I care about the labs. I care about the person's health traits and things that they're doing to take care of themselves, like the diet and lifestyle things we talked about. And that's how I look at my patients. And, I always wonder, like, people consider the things I do alternative therapy. Why is diet and lifestyle considered alternative? It's ridiculous, actually. This should be mainstream, and medicine should be the alternative therapy. This should be the last resort. But now many of you listening to this are in so much pain, you're dependent on the medicines to get you through the day. There's nobody really taught you how to fundamentally take care of yourself and the foundation from the ground up. So once you get on the meds, it's really hard to get off them. And, I get it. Sometimes patients come in and they have like a page and a half of the medicines they're taking. And I just think, how in the heck can they ever get better taking all these medicines? It's just not possible. So functional medicine can treat a lot of different conditions. I'm going to go over them a few here, just so you kind of get an idea of how we really look at things or conditions that we can look at and support in our office. So first, cardiometabolic stuff. So, we should all know by now that diabetes type 2 is reversible. So it's reversible. It's not a free pass. If you take metformin, you can still eat whatever you want. Things like high blood pressure can be reduced, and heart disease, some can be reduced. But, when situations that are complex, we always try to work with the cardiologist along with the patient. There are different neurological and psychiatric conditions that can be helped. Like, one of the most common things I see in my office these days are depression and anxiety. We can support people with dementia, Alzheimer's, migraine headaches. There was just a book written by a gentleman doctor out of UCLA. His name is Dr. Bresden, about how to cure Alzheimer's. So they have figured out a cure. It's been written up in the journal, and he basically says in his first chapter in the book, I want to thank my wife for turning me on to functional medicine, because without it, you can't help these people. You can't treat a condition with one medication. It's impossible. You have to treat the whole body. Also digestive disorders, things like IBS, ulcers, ulcerative colitis, acid reflux, constipation. These commonly are treated with functional medicine. Different autoimmune diseases. We see 2 or 3 patients a week, new patients a week, that have certain autoimmune conditions. And it's become more prevalent. The exposure that we're getting to all these different toxins out there is making our bodies react. So it wasn't prevalent when I was growing up. People did not have autoimmune issues. Maybe you knew one person who knew somebody that had MS, and that was it. And now in my practice, 1 out of 3, maybe 1 out of 5 patients have some autoimmune condition. Skin disorders, psoriasis, acne, eczema, these can all be benefited through functional medicine. And then different hormone issues like thyroid and chronic fatigue and postmenopause or premenopause symptoms can all be benefited from functional medicine. So the goal is to personalize the plan to that person. So we want to look at which part of the body is affected, what are the symptoms, how much inflammation there is. If there is tissue damage, that actually means there's an autoimmune issue. Autoimmune means your body is attacking its own self, its tissue. And then what are the potential causes? So we look at every patient from a metabolic, from a neurological, genetic, and then a structural standpoint. So my treatment model basically comes down to, we want to try to find the underlying cause, figure out which body systems are affected. Is it the GI system? Is it the thyroid? Is it the brain? Is it the skin? And then we look to see, is there any physiological damage? So is the body like starting to break itself down, like through a catabolic type physiology, or is it building itself up for an anabolic physiology? And then of course we have to address the symptoms and correlate it to, what's the underlying cause, the body system, the physiological damage. That's basically how I approach every patient. And then my care plans, of course, are going to consist of different lifestyle changes that I mentioned before, such as diet and exercise. We will give stress management tools such as meditation or maybe Tai Chi or belly breathing, different things that we can do to try to get the stress levels down. Frequently, we will recommend detoxification programs and various nutrients and supplementation for that particular person. So it drives me crazy when I see these neuropathy protocols that they think everybody fits under this box. It will never work. Well, actually, I won't say never. Every so often it's going to work. And it's going to work because that person just so happened to have the exact same problem as the person that made the protocol. So there are so many different causes of neuropathy and chronic degenerative issues that you just can't give one plan and hope that everybody fits under that plan. So if you're under a plan like that and you haven't seen results, change. It's not the right one for you. So the goal is to restore the imbalances that cause the specific condition in the first place. So if it's part of a liver problem, you need to support the liver. If it's kidney, you have to support the kidney. If it's just nerve, support the nerves. Oftentimes it's gut, it's brain, it's nerves, and every person, like I said, is different, and they must be personalized and individualized. Every single chronic health condition has a common thread. So on the left-hand side, you'll see all these different symptoms. You'll see neuropathy and vertigo, fibromyalgia, stenosis, IBS, and there's a whole list of conditions. On the right-hand side is all the things that cause it. So, and the list can go on and on. It's just a short list, but there can't be anemia because there has to be good oxygen flow to the brain and to the body. There can't be blood sugar issues because the brain takes 30% of our blood sugar, and there can't be deficiencies in either one of these, otherwise you're going to have issues. There can't be adrenal problems or hormonal issues. So you have to find the underlying cause. What happens is when you do have a metabolic imbalance, you're eventually going to have a neurological issue because it's going to decrease the frequency of firing of the brain. What does that mean? That means that through time, your brain is going to become more fatigued. So things like loud noise, long car rides will make you fatigued. If you read for short periods of time, you have to fall, you take a nap or you fall asleep. You can't stay in the moment. Bright lights can bother you. So these are signs of potential brain fatigue. Now this can be accelerated through, if you had a concussion or a traumatic brain injury, this can be accelerated. And eventually your nerve threshold becomes a little bit less. So to fire with a normal nerve, let's just say we need about this much space. And when the nerve becomes fatigued, now it only needs this much space. So it doesn't need a lot. So any bit of stimulus creates that nerve to fire. So that's why the noise starts to bother you. It doesn't have to be loud, but it just bothers you, and the bright lights. Tinnitus is a form of brain fatigue. So it becomes not only the conditions on the left, but there has to be an underlying metabolic, and will eventually cause some kind of neurological imbalance in the brain, which can then affect the central nerves and the peripheral nerves. So what does the research have to say? This is interesting. So in a Journal of Internal Medicine, they said if you made 4 lifestyle changes, you don't smoke, you exercise for 3.5 hours per week, you eat a healthy diet and maintain a healthy weight, that this is what happens. 93% diabetes prevention, 81% heart attack prevention, 50% stroke, and 36% cancer. So they did a study again, 30,000 people. They came up with the exact same data. So only 4 changes in behavior can have significant impact on your health. So heart disease, you have to look at genetics, right? There could always be a genetic factor, like some people just produce more cholesterol and have more plaquing and homocysteine and things that can cause cardiovascular disease, high blood pressure, high blood sugar, the cholesterol, like I mentioned. So the most significant thing that we just looked at in this study are lifestyle changes. They're the most effective tool to prevent these contributive factors and significantly reduce the risk of heart disease. So simple diet modifications for preventing heart disease are you have to eat a lot of fruits and vegetables, like 8 to 10 servings of colorful fruits and veggies a day. Stabilize blood sugar by eating small meals throughout the day and having healthy protein, fat, and good carbohydrates. You have to eat more fiber, like 50 grams a day. You have to avoid processed food. That should just be done all the time. Processed food has so many chemicals and preservatives that through time it's just not not that good for us. So that's why we hit a certain age and our body just goes tilt, and you're wondering, oh, I was so healthy my whole life. What happened? Well, it's the combination of eating the processed foods, exposure to all these chemicals, and various other environmental things that can happen to us. And then you have to eliminate the foods that have the bad oils in it. We want to eat more of the omega-3s, the krill oil, and the good olive oil, that kind of stuff. So I think I mentioned that anxiety is one of the most common things that I see in my practice these days. And in part, we are all in this fight or flight state. It's the state that should be suppressed most of the time by a part of our nervous system that's more the rest and digest part, the parasympathetic. But most of us have trouble sleeping, we have trouble digesting, and a lot of our neurotransmitters, especially serotonin, is actually made in the gut. So we have to work on finding the root cause of the anxiety. Conventional medicine actually looks at how to balance neurotransmitters. So they've given all these medications, these SSRIs and different things where, truthfully, they did a double-blind study with a placebo and it came out just as effective as Prozac. So but Prozac is a multi-billion-dollar industry. So you have to look at what's the cause of the depression? What's the cause of the anxiety? Is it problems in the gut? Is it food sensitivity? Is it, oh, there's so many causes, but that's what we do in our office. We try to run tests and try to figure out the cause. And as I said, 90% of serotonin is made in the gut. That's our feel-good neurotransmitter. So there is a huge gut-brain axis. They communicate nonstop with each other. In fact, the big nerve in our brain is called the vagus nerve. That's really our rest and digest nerve. Goes all the way from the brain to the gut. And it actually stimulates hydrochloric acid production so we can break down our enzymes or our food better. It actually helps with motility of our digestion, so to prevent constipation. So a lot of things can affect that gut-brain axis. So things like candida and small intestine bacterial overgrowth, different bacteria that shouldn't be there. This is an example of a patient that I actually had. Came in the office, symptom was depression. So what I did, I told you I'd look at the 4 systems: underlying cause, physiological damage, body systems, and then symptoms. And so what I found is after I ran tests that this person had a leaky gut, which was causing a nutrient deficiency, B12 primarily, and they had a GI infection, candida infection. And basically what we did is we just gave some probiotics. We fixed the leaky gut with some powder like glutamine. We gave a multi-mineral vitamin, and then we put them on a basic diet and antimicrobials and antifungals, and the depression cleared up. So another example, patient came in, same symptom, depression. Now what I did when I did the testing, I found that this patient had actually adrenal fatigue. So they had adrenal fatigue because their body had this reaction to gluten for so long, this food, that it created so much stress on the body was in actually a fight or flight mode. And there was so much inflammation in the body, it created this depression. So treatment was easy: eliminate gluten, give things like turmeric to help with the inflammation, or curcumin. We supported the adrenals with, I wrote down adrenatone, but there's a lot of adrenal supplements like to help regulate the cortisol levels, like ashwagandha. And then we just gave fish oil and vitamin D for the depression. So nutrient deficiencies in mental health is super related. They're basically interwoven. So we want to look at, when we look at a patient with some mental health issues, we want to look at B12 levels, folate, zinc, copper, omega-3, vitamin D, B6, and B2. I mentioned that functional medicine is also very beneficial for skin conditions. So our skin is our largest organ. And the 2 most common skin conditions that we see are eczema and psoriasis. So what we need to do in these patients, we have to look at, or what I do, is I basically look first at any food sensitivities. Because if you have a food sensitivity, it's going to make an inflammatory response, a cytokine response throughout the entire body, and it can manifest itself through the skin. We also want to look at the liver and how it basically detoxifies, because if things are becoming stagnant, we're not breaking down the toxins, this can create a toxic overload, which can again manifest itself in the skin. And then we put every patient that has an autoimmune issue on a no gluten, no dairy, no soy, no sugar, no alcohol diet. This is my basic anti-inflammatory autoimmune protocol. With the autoimmune, I will add no grains, and then I tell my patients stay hydrated, and then of course, like I mentioned a couple times already, avoid the processed foods. So in stress management, so cortisol is our basic fight or flight hormone. It's really to our benefit when we're under stress. We want to release cortisol so we actually have more energy and we can do things and handle the stress. But over a long period of time, cortisol becomes super harmful to our body, and it'll create adrenal fatigue. It's one of the leading causes of leaky gut. It can create brain fog, short-term memory loss. So cortisol over a long period of time is actually very detrimental to our health. So we need to support the whole HPA axis, hypothalamus, pituitary, adrenal axis, by doing different techniques. So some stress relieving techniques are meditation, exercise, diet, and then we do exercise to help stimulate that vagus nerve, that rest and digest nerve, which counteracts that fight or flight part of our nervous system. I'm going to be posting a blog here real soon about techniques that I do to help with vagal stim, and hopefully you'll follow the blog and maybe even a little webinar that you'll watch that you can learn some of these techniques. They're super helpful. And then detoxification. We try to put most of our patients eventually on some kind of detoxification program. We don't do it necessarily first because sometimes they can't handle the toxins leaving their body. So if you try to cleanse and you have this major reaction, your body wasn't ready for it yet. You have to support different things first before your body can handle the removal and the release of these toxins. It also has to be done the right way. So these one-day cleanses are actually ridiculous. Our body detoxifies 100,000 times a day, every single day. You can't do a cleanse for a day and think you're doing a lot of good. So detoxification needs to be done on a daily basis. And I think in the beginning, it needs to be a good 14-day or 28-day cleanse to really jumpstart it, to gradually remove these toxins from the body. So we focus on when the body eliminates these toxins to capture them and safely eliminate through the colon and the kidney to reduce this burden on the body, so we don't get this type of what they call a Herx reaction or a big flare-up due to this toxic release. And then supplementation. I'm big on supplements. I think we just don't get enough through food, and that's what supplementation is. Supplement our diet. If you eat that perfect diet and you're in good shape, maybe you don't need supplementation. But a lot of times with these chronic degenerative problems, we need to supplement, but we're doing so many, we don't even know what's working for us. So there has to be a plan. You have to figure out what are you gonna work on? Is it gonna be fixing the gut, detoxifying the liver, supporting the brain? These shotgun approaches don't always work because you're throwing so much of the body randomly that if you're still not handling what the major cause is, the problem is going to perpetuate itself. So they say our soils are depleted of our nutrients now. When we pick the fruits and veggies, then they store them, they transform the market, they're losing their mineral content. And I assume most of my patients that come in are mineral deficient, so I like to give them minerals and like to give them magnesium. There's also genetic alterations that can actually affect the way, what supplements we need. So we try to, like I said, personalize our approach to each patient. There is no one size that fits all. Every single patient is different. That's the functional medicine approach. So what to expect? I already talked about my treatment model. Most of you live far away. Even though we do distance patients, this is more of just trying to inform patients of what my model is. But patients in my office, I try to address these 4 things and try to really figure out a plan, what we need to address first with this patient, what we prioritize. Most people that I see have three main initiators of illness. So it's either emotional stress, dietary stress, or inflammation. So stress over a long time, as I talked about, increases that cortisol level, which will then affect the gut health, the adrenal glands, hormone tests. So it will, when the gut is affected, it affects really our immune system, because that's where 70 to 80% of our immune system resides, in the gut. So now we've affected our body's ability to handle stress, our hormones, and then it affects our immune system. So what happens is these toxins now build up in our body, and then we run different labs to figure out where it's all coming from. So the labs I like are an adrenal test, a hormone test. It's called the Dutch Hormone Test, that actually has both the adrenals and the hormones. I like to run a stool sample to look at the GI pathogens in there to see if there's any of these hidden illnesses, these stealth infections that we can't find, that our immune system keeps trying to attack. And then I run this test called the organic acids, which I say is my favorite test that nobody has ever heard of. It gives us a lot of information about the body. It gives us about neurotransmitters. It talks about gut health, nutrients, amino acids, how our body takes basic carbohydrates, proteins, and fats, converts it to energy. Most of us have, with our degenerative issue, even neuropathy or any kind of chronic health issue, we're going to have fatigue. So that means our mitochondria is not producing enough energy. The organic acid test will tell us why and then how to fix it. So as I mentioned, these are the tests I like to run: organic acids, Dutch hormone, the GI stool sample, which is called the GI map test. I like to look at genetics through Ancestry.com, then I upload it to another site. This site right now had me a while back, and maybe still, I haven't really checked, rank like the top 3 in the country to analyze genetics. And then I do, at certain patients, depending on what their symptoms are, I'll do a hair analysis looking for heavy metal toxicity. So our goals when a patient comes in is to look at their pain, set goals. We want to talk about different lifestyle things that we need to change, like food and sleep and exercise and meditation, stress reduction. Then we want to put together a program that's therapeutic in the beginning, and then transition through time. Now that it could take 3 months, sometimes the really hard case it takes 6, and transition it more to a long-term maintenance protocol. Anyway, thank you for listening. I hope you got some insight into this functional medicine. And if you haven't been exposed to it and you have these chronic health issues, you need to really find a functional medicine practitioner near you, or you can contact me, and I'm more than happy. I do these Skype and Zoom evaluations and all the time online. We treat a lot of distance patients, so if that interests you, you can contact my office. I'll just give you the phone number. It's 805-482-0723, and we can help you with that. Thank you so much.